So people think that physicians are immune from any disease or any chronic disease, but that's not true. We are experiencing burnout and we are not immune from anything. I have Dr. Suman Manchreddy here. He is board certified in internal medicine and he practices in Virginia, and he's my senior in medical school. So we are going to talk about what happened with him and what his experience is. And he's doing amazing work on creating awareness among Southeast Asians with about the heart disease and diabetes and other chronic diseases. So we're going to talk a little bit more about that. Suman, can you introduce yourself?
Yeah, hi, Nandini. Thanks for having me. My name is Suman Manchureddy. I'm a board certified internist. I'm practicing in Virginia, Northern Virginia. My interests are prevention of chronic disease and lifestyle medicine, and especially reversal of diabetes, and also catching disease at early stage. To prevent chronic disease, especially the heart and chronic kidney disease, or you name it. The reason we were talking about this because of what I went through. As a physician, as Nandini was saying, the medical professionals lately are under a lot of stress in a way that we haven't seen anything like this before. It's because there is a lot of stress secondary to technology. We're using a lot more computer added stuff to increase the burden on physicians. This has created a lot of stress, and for me, I had an issue when 2 years ago, it was around June of 2021, I started to feel heartburn, and I thought it was just an heartburn, so I was not thinking about anything serious, but the heartburn kept on going for the last couple of hours. It lasted at least an hour. And then at that point, I said, there is something going on. And my wife told me that we need to get this checked out. So I kind of agreed. And we went to the ER. And at that point, because I've been working in this hospital for a long time, almost close to a decade, and I pretty much know everybody in the hospital, And as I went in, and I still having this heartburn kind of pain, and never in a million years I thought it would be a heart-related event. And as they were hooking the machines, and the things usually we do as physicians, and people were doing to me, and it was unbelievable place where I was, because I was a patient this time. And as they were doing the EKG, because every time somebody comes with chest pain, we look for, heart attack and other related diseases. And as they were doing the EKG, it showed that I had a ST elevation, pretty big one. I mean, a pretty massive, pretty stark, significant ST elevations, which means that it's a heart attack. And as soon as I saw, I was like, is everything true, or this is something, I was not able to believe myself. And as soon as they found that, they have alerted the cardiologist, on-call cardiologist, and the attendings for my friends. And it was a real experience, what was going through. And as they were doing it, they rushed me to the angiogram, where they open up the vessels. So since it's an emergency, and and I was not, and at that time my pain was just going like 20 out of 10. It was pretty significant. And they tried to give pain medications, but it was not helping. And I was taken to the angiogram, and I was on the table as they were doing the angiogram. At that time, they found that my right coronary artery was 100% blocked. And as I went in and trying to take the plaque and trying to put the stent in, at that particular time, I went into cardiac arrest, and they had to shock me 6 times because my heart went into arrhythmia, life-threatening arrhythmia, and they had to shock me to revive me back. And luckily, things worked out, and then after that, I was moved to ICU. So all this has taught me a whole lot of stuff, because since last, I would say 5 years ago, when I started my own practice, there was a lot more stress on myself. Obviously, lifestyle-wise, I was working 24/7. I was on call all the time. I would say just taking care of patients, seeing a lot more every single day, and there was no breaks, and especially disturbances through nights. So I was thinking during my ICU stay, like, what could have caused? Why would I, a 43-year-old from Southeast Asia.
So you were just 43, Suman, when all this happened?
Yeah.
Oh my
Yes,
God,
when
that
it
is
happened,
scary.
I was just 43.
Wow.
And I was just, contemplating, like, what exactly happened here? Why did it happen? Because I do half marathons. I just had a half marathon just the month before. And I do run. If I run for 5 miles, like at least once a week. So I was not totally not doing anything physically, but that particular time, I don't know what happened, but it just happened. And but luckily I survived. I'm here. I'm able to get back to my medicine, seeing my patients. But I mean, things have changed since then. I mean, I was working so much more before, but after this event, it has taught me a whole lot about the perspective has changed, because, it has really put me in a place where I have to think about to do what I really like. So my interests are in prevention of disease, chronic disease. And this has really put a spotlight on, what exactly could have happened. And that's when I started to researching in deeper manner and looking at trials, looking at data from US, India, all over the globe, actually. And I found out that the Southeast Asians are much more prone for heart disease. We have 60% of cardiac deaths, the heart disease deaths, coming from Southeast Asia, which is alarming. I mean, and mostly young folks. I'm talking about less than 50 years of age, with sudden cardiac events and deaths. So compared to 100% of cardiac deaths all over the globe, 60% come from Southeast Asia, which is Bangladesh, Pakistan, and India, which corresponds to almost 2 billion people. And it's a pretty alarming rate. And I also found in one of the journals in one small city where they have said that 25% of deaths below 40 has claimed related to heart disease. So it's pretty alarming figures. I know we do see here and there about South Asian ancestry, South Asian descent, celebrity suddenly dropping dead, and we kind of go around and think like, what happened here? He exercises, he eats right, he does everything, and suddenly they drop dead. And so there are not one thing that is
You're
going
doing
on
some
here.
kind of research on this, right? Suman, can you tell us a little bit about that? Like what, and you're doing some kind of like patient investigations and all that. So,
Yeah. So what I found was there was extreme interest in when I found out why this happened to me. Then I started digging into the data, and what I found was pretty significant in pre-diabetes. This the term we call insulin resistance, which is where the sugar is floating in your bloodstream and is not being absorbed. And this is the levels before the actual diabetes. So people can stay in pre-diabetes from 7 to 10 years before they turn into full-blown diabetes, where your sugars are very high. So what the data has shown that in these populations, the pre-diabetes people are much more prone for heart disease, and these are the ones can cause sudden cardiac events and sudden cardiac deaths. So in my practice, I've changed the way how I look at people now. Every South Asian is a high risk patient, no matter what. I don't consider South Asians, yeah, it's okay, do some physical. No, I mean, I think we have to go to the bottom of it. So everybody gets a glucose tolerance test in my practice, and I go really, really deep, and I make sure that their postprandial sugars are not too high. And I catch these folks very early on and start encouraging to have a better lifestyle, especially the carb loading should go away. And by doing that, what happens is your sugars drop, and that has shown to help, especially the chronic disease, the plaque buildup in your coronaries, and also full-blown diabetes at later stage. So that's one aspect of it. And the second aspect of it is the cholesterol. So we know that the data has very strong on the cholesterol, and coming from South Asia, we have certain issue with cholesterol, because usually what happens is when the sugars are high, the triglycerides tends to be higher too. And when that happens, when the triglycerides are higher, you are more prone for future risk for diabetes, then future risk of heart disease. And it has proven time and time again that when you're carb loading, especially Southeast Asians, we love to eat rice-related foods. We love to eat carbohydrates and heavy quantities too. And when that happens, our cholesterols or sugars, and together, the third important element is the blood pressure. So when the blood pressure fluctuations happen, that's when the heart and the arteries, the coronaries around the heart, have real big impact and leading to the plaque rupture and causing heart disease or sudden heart attack. So what I tell folks is to have very stringent on looking at, if you're a South Asian, you are prone for heart disease. You're prone for sudden cardiac event, especially a male, and especially if you are below 50. So you want to make sure that you don't have blood sugar issues, even if you don't have pre-diabetes. If you have pre-diabetes, get it checked out, get it treated aggressively, and stay away from carbohydrates, including limiting or removing rice from your diet. That is very, very important. If the blood pressure is higher, you have to treat it. You have to treat it even if it is more than 130 by 80. You know, you have to be very, very aggressive on getting the blood pressure down. And the third thing is cholesterol. Cholesterol is very, very important, and especially you have to look at HDL cholesterol and non-HDL cholesterol. And I know the Framingham scores say otherwise, but I consider it's the problem is there are not many South Asian studies done. There are a few people who are doing right now in called masala studies and mesa studies. I mean, these are people who are working on people who are living here in US with to see what might have affected these folks, why these folks are really getting sicker, having a lot more chronic disease, and the ways to prevent it. So they're working pretty diligently on all these subjects. And coming to these things, I think we have to have an approach towards the disease in Southeast Asian population, because we are different. You know, the other aspects of coronary disease is we do have smaller coronaries for some reason. Genetically, South Asian people have smaller coronaries, which has time and time shown again that might be one of the factors too for having early heart disease. And the second part of the issue is that South Asians also tend to have lower beta cell mass, which is pancreatic mass. So there's only 70% of pancreas work in this population. So that will increase the chance of prediabetes and diabetes, and in return causing heart disease. So, and also interesting fact that you don't have to have 100% of plaque buildup. You just need to have 25% plaque buildup. And that can rupture at any given time, causing the heart to have heart attack, you know. And this can lead to, sudden cardiac death. It can lead to a heart attack that needed intervention right away, you know. So there are steps needs to be taken, and go ahead if you have any questions on that.
So, what are lifestyle changes are you advising patients right now? And my other question is, do you check for genetic markers when they have, if Southeast Asian population, if they have like high cholesterol and stuff? Like, I mean, do you check for ApoB and Lipo-A and all those genetic markers? Because I'm seeing a lot of those like being elevated in the Southeast Asian population, and I'm like counseling the patients, this is the right time, we're going to start like cholesterol medication and stuff. And most of the Southeast Asian population in my practice, they are very apprehensive when you say the word medication. So
Yes.
how do you do that? Like,
so like I said, I do a very detailed analysis. I do all those lipoprotein A, ApoB, ApoA1, and all the cholesterol panels. I even do LDL particle number and all that. Very detailed testing. When they come first time, I do a very detailed testing. And then I get, if any of the labs are elevated, especially the ApoB and non-HDL, these are the two determinants I go by. You know, LPA, I do it. If it is really high, then we have to send it to either a lipidologist or a cardiologist to have risk assessment for them separately. But to have to have other cholesterol, if they're abnormal, I usually send them for a coronary calcium score. So that way I know when the plaque buildup is going on. I'm not looking for a complete plaque buildup. I'm just looking for, if there is a even a 10-20% of plaque buildup, the calcium score about 10, that means that the disease has already started. So I go really aggressive on those folks, and we take care of by statins and other modalities to bring those numbers down, you know. And the other part of the thing is I do something called uric acid, which is one of the most important element of it, because lately a lot of research is done on if the uric acid is really high, that has shown to have premature death. That has shown to have that has shown to have metabolic involvement in metabolic disease and blood pressure management and blood pressure issues. So the first thing you want to do, if it is really high, especially more than 7 of uric acid, you want to bring it down. That's what I tend to do. And the fifth thing, and the blood pressure, like I already said, it's very important. You want to bring it as low as possible, which is shown again in the sprint trial to want to keep it around 120/80. That's the goal should be. And the fifth one I usually find out is the vitamin D, which is very, very important. I think especially if you're a darker skin individual, if you're brown skin individual, African American. It boggles my mind that you come from an area where there's abundant sun, but unfortunately these days, because we become technological savvy and doing all these computers, we don't even go out, which has caused huge problems. I've written extensively about vitamin D, and it's an important element that we all need to have, and everybody should be outdoors for a limited amount of time, no matter what time of the year. At least a half an hour a day, they have to go out, even if it's cold, hot, whatever, what have you. And it has shown a lot of other benefits. It's not just the vitamin D. It has shown a lot of benefits because your serotonin goes up. You feel happy. You're seeing outside. There are a lot of other factors that works, but going out in a day, at least half an hour, definitely helps, because it helps walking. There are other things that happens at this time that I think if you look at the whole overall picture, I think the going outdoors, the vitamin D is very, very essential. So, like I said, the 5 things that I always tell my patients: the blood pressure, blood sugars, blood cholesterol, uric acid, and vitamin D. If you're able to keep them in the optimum number, usually most of the cells get repaired by itself, because you're providing that environment for the body to prevent any chronic disease. When these steps go all over the place, then that's when the diseases start. And I'm working on how to kind of get them into that proper place. I know, like you said, there's a lot of apprehension among Indian Americans or Asian Americans about taking medications, which is, I think, very cultural. We come from backgrounds where we have so many other modalities of medicine, if you can say, Ayurvedic, Unani, there are a lot of ancient traditional medicines, and our mind kind of goes like one place to other, because we've been wired differently. Most of the South Asian population wired differently, and allopathy is just one part of it. It's not the part of it, and that's I think the biggest crux of the problem. Even if you talk to a lot of physicians or medical professionals, they too kind of believe in some of those things. I've seen it, myself. So I think we just have to educate them. I know it's a lot more time consuming, but that's what I try to do. I try to sit with them, talk to them, understand their anxieties, and I'm trying to write about more of these issues that we face. Somebody will be able to get it and hopefully, take care of themselves. So
Yeah,
that's
that's
what I'm
good.
trying to do.
Yeah. Amazing. Like, the work what you're doing is really good. Tell us a little bit about the blog, what you write, so that I can share the link in my YouTube channel as well. So
Yeah,
everybody
sure.
knows about it.
It's called Spider Doc, as in SPYDERDOC, .substack.com. It's about just a basic understanding of disease process. The diseases are there for a long time, but we need to rethink how the diseases are in this age, because the thing is, there's a lot of new information that's going on, and we don't know. We are not able to get the exact information, and unless we spend time on it, unless we spend our energies on it, we're not going to get the data. So my sincere effort is to get those information to the public in a very simple language, and hoping they can understand. And I've been getting a lot of feedback from a lot of people, which they all like it. So that is encouraging to me. So I'm writing more, and I'm planning to do one a month or so. And so anybody can check it out. It's free. There's no money or anything. So it's a free blog. It's all about day-to-day medical practice, and mainly about prevention of disease. So that's where I'm kind of working on. So
yeah, I read your blogs every month, pretty much, Suman, and I was really impressed with and that's the whole reason why I started a YouTube channel, to create awareness. And it was with the primary care practice, we get so much caught on with so when the patients go back, like there is some information to look into, there's some information to revisit and share it with their family and friends. That's the whole idea about it. And I'm so glad you're doing that, and I'm really amazed with the work that you're doing. And anything else you want to tell our viewers?
no, I think like you were saying, the South Asian population is one of the biggest and the most labor force population. I mean, they are the ones who are going to give labor to the next generation, I think. And we have a lot of young folks and a lot of young people coming from the continent. And I think this is the biggest problem. We're going to face next decade to 2 decades until we find a solution for this, either a genetic solution. I don't know what's out there, which is going to come eventually. But the thing is, our lifestyles are changing, our way of modalities, our transportations are changing, and we are doing less and less of physical activities. We are consuming more. We are doing the things we are not supposed to do, and we are popping in more pills. But again, we have to look at it differently. If you want to have a long quality life, quality means not quantity, it's quality. Because the longer you live, you want to have a quality life. So the longevity matters when you take care of your health now. Because the thing, as we are seeing, the average South Asian lives to be in mid-60s to maybe 69, 70 now, compared to Caucasian who lives to 80, 82. So I think we need to have more awareness. We need to have more information, more education. And all this needs to be in place. And I think you are doing your part, and I'm also trying to do my part. I know it's a drop in the ocean, but it's a start. Right? And
exactly.
And I think we got to keep moving on, and hoping somebody will see it and able to get the information and take care of themselves.
Yeah, that's really good. And thank you so much for joining and sharing your story, Suman. And I'm really amazed, the work which you're doing. And I'm glad you shared the story, because it's going to be an inspiration for a lot of people who are watching this. And definitely try to comment, try to share. I mean, if you have any Southeast Asian friends who are going through this kind of stuff, please try to share it with them. And I mean, this is all about creating awareness. And thank you for joining. Thank you, Suman. Don't forget to subscribe. And if you have any questions, please do email me at styleyourhealthmd@gmail.com. Thank you.